There has been a considerable interest in discussion of the stroke, so we'll continue discussing stroke for the next couple of videos, and I will try to give you as much education as possible. First, we need to understand that there are two types of strokes. There is ischemic stroke, when the clot gets stuck in a vessel and the area that is supplied by that vessel dies. That's an ischemic stroke. But also there is a hemorrhagic stroke or bleeding in the brain when the vessel ruptures and the blood spills out inside of the brain. Those, even though they all called stroke, they have a completely different way to treat it, and also very commonly very different reason for those strokes. So unfortunately, we don't know which type of the stroke patient may have. When patients ask me what medications they should take if they have a sign of the stroke, unfortunately, I cannot tell them that, because if you'll take aspirin, a lot of aspirin, and you have a hemorrhagic stroke, you actually may worsen your bleeding. At the same time, if you will take something else, then you potentially can worsen your ischemic stroke. 85% of strokes are ischemic, so statistically, you potentially will have higher chance of developing ischemic stroke than a hemorrhage. Hemorrhagic strokes commonly are associated with a headache and neurological deficits, but not in everybody. And I've seen a number of patients when we thought the patient would have a ischemic stroke and CAT scan or further imaging demonstrated a bleeding in the brain. So again, we don't know what kind of stroke you have. The best way to figure it out is to actually get a CAT scan in the emergency room for emergency evaluation. Share with others, and we will be talking more about strokes in future videos.